Welcome back at Chaos Control. On the phone, we should have Illinois GOP governor who's running. Sir, can you hear me?
Yep, I'm here.
Hey, well, I don't know if you could hear, we had the Illinois GOP chairman on here. He talked a little bit about healthcare. What is your stance on healthcare?
Well, as it relates to the state, the real issues are our Medicaid program, which is a federal state joint program that's designed to provide quality health insurance to the 1.7 million low-income individuals in the state who qualify for Medicaid. And we have a real problem in Illinois because it's a system that we're spending 25% more on this year than we did just 3 years ago. It's a system that we can't financially sustain in its current form. So even as we're spending more and more money on it, because we're not paying our Medicaid bills, you have fewer and fewer quality health care providers that are accepting Medicaid patients. So we need to completely rethink and reorder our state's Medicaid program to both impose some cost containment in the system to respect the taxpayers who finance it, as well as to improve the quality of access to care that low-income individuals are able to obtain.
You said you're talking about the Medicare. What exactly needs to be done to change the way things are done here in Illinois or even on a national level?
Well, I'm talking about Medicaid. Medicare is a federal program. The state program is Medicaid. At the state level, what I would suggest doing, and have suggested doing, is setting up premium assistance programs, essentially getting waivers from the federal government for the dollars that they sent to Illinois to support our state Medicaid program, and then using that money to help low-income individuals buy health insurance in the private marketplace, just like anybody else does. But then after giving them that opportunity, giving them that hand up, they would be responsible for the healthcare decisions they make and the associated costs of those healthcare decisions. So, in other words, it's giving people the opportunity to obtain quality health insurance, but then treating them like an adult and making them take responsibility for their healthcare decisions and the associated costs, just like just like anybody else does who has an HMO that they buy in the private health insurance market today.
Now, what's your stance on the 1,990 page healthcare bill that for the U.S.? I know that will trickle down to Illinois. Obama says that the state will have the option for the public option. The state can choose if they want to opt in or opt out. To me, that seems like U.S. or the Illinois taxpayers would just be paying taxes, but not taking the option if they opted out. Is that correct?
Well, so we're going to get hammered either way. Whether if they pass that abomination of a health care bill, all that is a backdoor federal government takeover of health care. It's a horrible, horrible idea. It would change the nature of our country and decimate our quality of life and certainly our quality of health care in rapid fashion, as it has with the quality of health care that Canadians have access to, that the British have access to, and any other country who's gone to a nationalized health care system has. So it's a terribly bad idea. It requires confiscatory taxes, particularly on small businesses, to finance. You're talking about $1.4 trillion expenditure, money that we don't have right now, and it would forever change the healthcare landscape in this state and this nation in a negative way. So it is something I'm adamantly opposed to. The last thing we need is more federal involvement in healthcare. The reason we have cost overruns now, the reason that Medicare is insolvent, the reason that we have these Medicaid cost overruns that I was speaking about is because of governmental involvement already. We need to move towards more market-based solutions and away from a federal one-size-fits-all mandate.
So if the federal government isn't doing Medicare, Medicaid, or any of that, how do you want private businesses to do health insurance, or what do you propose there?
Well, that's exactly what happens now. I mean, essentially, most people get insurance through their employers, or they buy private health insurance in the open marketplace. You're talking about a very small fraction of Americans who are chronically uninsured. So you deal with the specific problems that our health insurance system, as it currently is constituted, has. And the two main problems are folks that are chronically uninsured, which is about 8 to 10 million Americans out of a universe of 300 million, and those folks with pre-existing conditions that cannot get health insurance. You deal with those specific problems. You don't have a government power grab to take over the entire system. So you can come up with market-based solutions to offer healthcare products to those specific populations and provide incentives for health insurance companies to extend that coverage, employers to extend that coverage, without having the government come in and take the whole thing over.
So for those 10 million people then, do you expect government Medicaid like it is now, or how would you take care of those 10 million citizens?
Well, like I said, I would incentivize the extension of health insurance to those folks, just as I talked about with the premium assistance programs that I'm talking about for currently Medicaid eligible folks in Illinois. So you give them the opportunity to access quality health insurance that gives them the ability to obtain health care when they need it. And then you force them to take, and you give them and you force them to take dominion over their own lives, to manage those decisions and to respect the opportunity they've been provided by somebody else in terms of making sure they have access to quality care. I mean, that's a responsible way to do it, that tailors a solution to the specific needs of a specific segment of the population, rather than, again, stripping away health insurance that most folks are happy with and creating this one-size-fits-all system of mediocre, at best, health insurance coverage where you're really lowering the quality of care for everyone. That is not a reasonable solution.
Okay, one last question, Dan. What makes you different from the other candidates running for governor?
Well, it's pretty simple. My value proposition is real simple. If you believe that what is required to improve conditions in Illinois, to reform our state government, to enhance our quality of life, it's just simple reforms on the margins, a tinker here and a tweak there, then there's a whole host of other candidates you should vote for that are content to manage the decline of this state. If, however, you believe what's required is policy revolution in Springfield, and I mean revolution, a complete rethinking and reordering of all of the big-ticket systems in state government, not a single one of which is financially sustainable in its current form, not a single one of which serves people who play by the rules and have been gamed by a system they finance, then I'm the only candidate speaking in that parlance and the only candidate proposing specific ideas consistent with bringing policy revolution to Springfield on behalf of people who play by the rules in the state. And for folks who are interested in joining my policy revolution, they can visit my website at Proft2010.com.
Okay, thank you, Dan, for coming on to the show. Is there anything else you'd like to add?
No, I appreciate the opportunity. It's great to speak with you. And like I said, Proft2010.com is my website for those who are interested to learn more about my candidacy or to get involved with it.
Okay, thank you very much for coming on to the show.